because too much progesterone is not a good thing either. She's going to feel super tired and lethargic. Her breasts are going to ache. She get headaches from it. She could lower her insulin sensitivity. So a lot of things can happen when you take too much progesterone.
Yeah.
Yeah.
Do you think the reason the physician wanted to start her at 400 is just to try to hit her with guns blazing?
No, it's because that's what they think the medically appropriate dose is. That's just like, physicians who prescribe pellets and they think it's normal for a woman's testosterone to be on at 200, or 300.
Oh,
It's not.
yeah.
the
No,
real
you're
life
right.
the real life results and application of that can be quite disastrous. Yeah.
Yeah, because if you think about it, I mean, Carrie is currently, I mean, her progesterone is like nil, and
Yeah.
so all of a sudden, if we give her 400 milligrams a day for 10 days.
Right. You also don't want to go from like zero to 100 right away, so to speak. So that's why I said titrate up. And also you got to get lab work checked. So like you want her to be, on paper, you want the range obviously to be somewhat within, the optimal range, but pay attention more so to her symptoms. And if she's feeling good, but she's still low end optimal, that doesn't mean that you should have her take more to get her to like a perfect number, you know?
Mhm.
So it's like a HRT is still very, very new in terms of like medical approaches. It's still a very new thing.
Yeah.
And honestly, like, I don't know a single doctor or HRT clinic or coach or whatever who knows HRT perfectly because it varies so much from individual to individual. There's so many different ways that you can titrate it and dose it that it's like it's infinitely like, complex.
Yeah. Yeah. So it's kind
Yeah.
of like, I mean, she's throwing so much at her, not knowing what might
Yeah.
happen.
Yeah. And it can take months to years getting HRT right for a client or patient. You know, nobody knows like the exact protocol right off the bat. I certainly don't,
Yeah.
you know.
Um, so if I'm getting this straight, we're doing it for 10 days and then
Mhm.
we're stopping. What is the goal after those 10 days?
Mm. Well, because she's young, the goal is that you don't take progesterone around the clock, basically, so that her monthly cycle returns. Because, older women who elect to use HRT may want 24/7 dosing of progesterone because it'll eliminate a monthly bleed. So, for some sense of like normalcy, younger women, closer to their ovulatory age, will prefer cyclical dosing of progesterone. And that's why we take it during the luteal phase, where it would naturally be high anyway if she wasn't on HRT.
Okay. So
Yeah.
since right now she doesn't actually have a cycle, we're just picking a time
Right.
to
You're
start.
just picking like an arbitrary date, yeah, and start dosing it, quote unquote, in her luteal phase, you know?
Uh-huh.
So in
And
this case, like since the system hasn't been running, you're picking a time to pull the lever on the luteal phase, right? Otherwise, you would sync with the system, but we're gonna start the system where we want it.
uh-huh.
It's like winding a clock to the time that you want it to start ticking,
Yeah.
right? Yeah,
Okay.
wind the watch.
So we have the 10 days on. Now,
Yep.
more than likely, I mean, she's not going to start a period all of a sudden.
No, no, but over time, you need time for that follicular cycle to begin,
Hmm.
right?
Yeah.
And so normally, the follicular cycle, in the follicular phase, you would have estrogen dominate the phase.
Hmm.
And then that's building up the uterine lining, right? The endometrium.
Yep.
And then when usually the cells would produce the corpus luteum, luteal phase would be triggered, right? Then the progesterone is what triggers the shedding of that lining.
Uh-huh. And so then, so she's going to take a certain amount of time because her doctor didn't really give her then the follow up after that, right? So it's okay, take this for 10 days,
Mm-hmm. Yeah,
right? So,
you take it for 10 days and you stop,
and then that's it.
and then you take it for 10 days again.
Right. So I don't think that the doctor kind of gave her that information and that
Oh,
follow.
well, yeah, she's not just going to take progesterone for 10 days
Well, that's
and,
what I thought. I
and
think she's
never
like,
take it again. No, it's like every, like, you
it's
know,
like how we're doing the Vitex,
exactly, exactly.
but
Yeah,
now we're actually giving.
the real thing. Yeah,
Yeah.
because
Okay.
Vitex is chaseberry, right? So that's like what I call like, I think in my macros algorithm class, I mentioned Vitex as like a tier one
Yep.
hormonal support because you're using like natural herbs to like stimulate,
The
you know,
signaling.
yeah, it's sort of like using myo-inositol or a GDA as like an insulin mimicker. And
Yep.
then like the next step is like, I don't know, maybe glipizide and metformin. And then the next step after that is, a Humalog or a Novolin or a Lantus.
Yep.
Right? So then you're going from like natural support, which boosts endogenous production, then you're going straight into exogenous administration of a hormone, right?
Uh-huh.
So that's the same concept with Vitex slash Chaseberry and Bezwecken, which is a
Yeah.
low
Okay.
dose over the counter, which delivers like 40 milligrams of progesterone. And then you get into the progesterone pills, which can be 100 milligrams, 200 or higher if they choose to compound it that way. Yeah.
Aha. Okay.
So there's steps to treating hormonal issues. Yeah.
Yeah. So then that, your progesterone is your next tier, and then now we're boosting it with the
Exogenous.
exogenous.
Yeah,
Okay.
exactly. Yeah. I mean,
Um,
it's like,